I'm Edie Lush, and I'm outside the Hub Culture Ice House Pavilion in Davos. Delighted to be joined now by Dr. Soka Moses. Thanks very much for coming along.
Thank you very much.
From the Elwa Hospital and also the Ministry of Health in Liberia. Now tell me, the other night inside here, we saw some very moving movies actually about your experience. Tell me first of all about that experience that you had working as a physician in Ebola.
Thank you very much. So I'm a physician working with the Ministry of Health in one of the largest free public health hospitals in Monrovia, the capital city. Just to give you a brief background, Liberia is a small country with 4.5 million people, and Monrovia is home to about 35% of that. And Monrovia happened to be the biggest epicenter for the Ebola outbreak. Now, and in a country where up to 80% of the population live on under $1.25 a day, you can understand that my hospital was the natural direction for people to come for free health care and services. So when an outbreak started, one of our nurses working in the emergency room got infected, and every one of us who were providing care to our colleague, we were at risk, we were exposed to her. And in the end, up to about 13 persons from our hospital became infected. Many of them died. But that was just the beginning. Fast tracking on to August, by that time, it was late. You have infections on the streets, you have infections in all counties. So many people were at risk. So many people were contacts of Ebola patients. And help came along, and that help was very helpful, but it was very slow in coming. It was very, very slow in coming. So there was a terrible experience in the end. We had about more than 11,000 persons in Liberia becoming infected, and more than 4,500 of the deaths were documented. I say documented because during the early days of the outbreak, when people's perceptions were not as well, they didn't well understand how the infection spread, they were in denial. What happened is that some of the deaths we believe were not reported. So I think there were more.
And how do you think the trust in the community affected your experience?
Trust in the community was very important. We live in a part of the world where people feel very, very dissatisfied with authorities. And when the outbreak started, you can understand that we've never had an outbreak of Ebola in West Africa. So no one in the communities believed that Ebola will ever leave from Central and Eastern Africa to come to Liberia or West Africa. So they did not believe the messages, they did not believe there was an outbreak, they did not take their preventive public health messages that we were giving. And some of the messages actually contrasted with their cultures and customs, with their ordinary ways of life.
Like
so
what?
For example, traditional burial practices. We live in big families, in communal neighborhoods with our sisters and cousins and brothers, in big families, in little homes and so forth. So that kind of togetherness in a small community with our traditional practices were just the proper, it's like a perfect storm. It was the proper ideal condition for rapid spread of Ebola.
And how do you think, looking at potential for more epidemics, other parts of the world, what did you learn in that experience that you think might help later on?
I think community trust is very, very important moving onwards. Because if the community doesn't trust you, if the community is not aware of what's happening in the scientific community, it's going to be difficult for them to accept.
And how do you build that? How do you build trust?
We need to get closer to community at every step of the way from the beginning of research. We need to inform them, they need to be a part of our engagement, they need to be part of the programs, the preventive messages in developing at all levels of the healthcare ladder. We need to work with them. Communication need to get to them real time. That's the first thing. The next thing is it's important that we prepare our public health systems, our public health infrastructure to be resilient enough to be able to pick up these kinds of outbreaks early on, early warning systems, alert systems, so that we prevent them from spreading as fast as they can. We cannot stop outbreaks. We know that we live in a region where Lassa fever, yellow fever, measles, polio, HIV, tuberculosis, and you can name them. And malaria and pneumonia is still the highest kill of children in West Africa, especially in my country. So we know that outbreaks will happen. But what we are able to do is to be able to strengthen our systems so that we're able to identify them early on and prevent transmission, secondary transmission, appropriate and rapid containment.
Thank you so much for stopping by the Hub Culture Pavilion here in Davos.
Thank you
Stay
for
warm.
having me. Thank you.
And I'm Edie Lush.